If you're using the foam roller as an adult who loves running to improve recovery and soft tissue mobility, that's awesome. But I'm going to show you today why I love the foam roller for an upper body workout and a core strengthening program as much as for the benefits to the soft tissue. So it's all the same exercise that you guys have been doing. I usually start with the least threatening first and then progress to the most aggressive. And what I mean by that is most of my clients will start simply sitting on the foam roll, doing the hamstring foam roll technique. Super simple, very basic. You could do one leg back and forth or both. But if you notice, what's happening here is my hands are pressing down now. I'm on basically the ball of the knuckles of my palm, like the ball of your foot, but for your hand. I'm creating scapular depression. I'm tightening the abs almost like a little V-up or a crunch. And then I'm extending through the shoulders. So I'm getting a core workout as I do the foam roll for the soft tissue mobility. I usually do about 60 seconds of each body part. Once I finish the hamstrings, I go down to the calf. I basically do the same thing. I'm scapular depressing to lift my body. I'm providing a little rocking motion through the mid-calf. If this is too easy, I'll switch and go to a single leg if I want to target a specific area. I'll do about 60 seconds on each leg or 60 seconds combined. Once I finish that, a lot of times what I'll do is I'll migrate to the back pocket or the piriformis, the gluteus medius, any of those areas. I like to angle the foam roll so that it kind of moves in line with gluteus maximus. I'll do it with the support leg down. And then if I want to target the piriformis muscle a little more, I'll cross my legs in this figure 4 position. So I'll typically do 1 minute on my right, and then of course I'll switch. I'll get 1 minute on my left. From there, I'll work on the quadricep. And so whether I'm doing both quads at the same time, or I choose to focus on one quad at a time, from a core strengthening perspective, you can see how I'm in a plank position. So my abdominals are engaged, my glutes are tight, my scapular protractors are working to push the earth away from my body. And then of course, once I finish that, I usually will hit the IT band. Either I'll stack my legs or I'll keep one down if the stack is too aggressive. From here, I'm effectively doing a side plank, so my obliques, my shoulder stabilizers, the side of my neck, all of these upper body muscles are working while I'm doing the foam roll exercise to address the soft tissue issues in the lower leg. And then the last one I typically do, it's going to be the adductors or the inner thigh. I'll line the foam roll up with my lower leg, the tibia. I'll move perpendicular to kind of open up the hip and massage the inner thigh, the gracilis and other hip adductors. Those are the muscles that pull the foot in toward the midline. A routine like this might take 5 to 6 minutes. You hit all of the major body parts. You get the soft tissue benefits in the legs, but you get the strengthening and stability benefits in the core and the upper body. I do this about 3 times a week, and it just keeps me generally well.